Welcome back, everyone. It is Dr. Lindner, and what we're going to be looking at now is going to be understanding not just anatomical position, which is really important, but understanding how we name other parts of the body. So, whenever we are referring to other parts of the body, we always have to understand this position that this young lady is in, which is referred to as anatomical position. Anatomical position is when the person's feet are flat on the floor. Notice the palms are facing anterior. It's the first time you heard me use that word, anterior, which means it's facing forward. Before, in another video, you heard me use the word posterior, which means on the back side. So this is the reference point that we need to understand when we even count fingers. This is digit 1, digit 2, 3, 4, and the pinky is digit 5. This is an anatomical position. The thumb is lateral. The thumb, I'll put an L for lateral, meaning it's away from midline. And then the pinky is more medial because it's closer to the midline of the body. So you're going to hear me use the word lateral and medial, not middle, but medial. So anatomical position, remember, hands at the side, palms facing forward. There's two other terms, supine and prone. They're both refer to the person lying down, but supine, the person is face up, and prone, you're face down. An easy way to remember it is supine, you're lying on your spine. If you're supine, you're lying on your spine, which means you're face up. And when you're prone, you're lying on your bone, which is your nose, which means you're lying face down. So here, this is a question that has shown up in the past on these McGraw-Hill Connect Lab quizzes. So here we're looking at a person lying face down. They're on their bone, and if they're on their bone, they are prone. Here, if we look at that bottom picture, they're prone, they're lying on their bone. We know that means facing down, and it's the opposite of supine. So if we look at the top picture, they're supine because they're lying on their spine. They are lying face up, and that is the opposite of prone. And again, this has shown up in a past quiz where it was like drag and drop. You like left click and drag the appropriate terms to fit the picture. Right in the center, we said that is anatomical position, feet flat on the floor, and the person standing erect straight, and the palms are facing anterior or forward. Supine is on the spine, prone is on the bone. All right, let's take a look. This is kind of important to understand this terminology, and it does show up quite a bit on the quizzes. I think that sometimes this stuff may show up. It talks about Appendix A and Appendix B, I think somewhere in the assignments, and students always go, where's Appendix B? And for some reason, it's after Chapter 10. Okay, so you have to look at the beginning for Appendix A, and then Appendix B is immediately after Chapter 10 on the ebook. You'll see it. And it goes over, I think, not just this, but it goes over other dissections of the human body so that you know where's the pancreas, where's the stomach, where's the liver, right? It goes over some of the internal anatomy, not just superficial anatomy that we're looking at now. So superficial, when we look at the front of the head here, this is the frontal bone or frontal. When we look at the nose, we call it nasal. When we look at the eyes, we either say it's ocular or orbital. When we look at the ear, we use the word otic. We talk about the cheek, we use the word buccal. And this word buccal will come to haunt us again when we do muscles of the face. When we get into muscles in another week or so, there's a muscle called the buccinator. Well, once you learn buccal is cheek, when you see a muscle called the buccinator, you're going to have to say to yourself, it's got to be near the cheek somewhere. The neck is called cervical, and we know the cervical spine is C1 to C7 vertebrae. The C is for cervical, which means neck. Women know that because, God forbid, sometimes women get cervical cancer, which is the neck of the uterus. The uterus has a neck as well called the cervix. It's called cervix cancer or cervical cancer. We have the skull, which we refer to as the cranial, and then the face is facial. When we combine the skull or the cranial with the facial, we say it's cephalic, which means head. Mouth is oral, and the chin is mental. When we do bones, we will learn about two holes, one here and one here, and holes are called foramen because they're on the chin. They call it the mental foramen, the holes in the chin, mental foramen. So mental is the chin. The armpit is called the axilla or the axillary. So when you do blood vessels and you learn about the axillary artery or axillary vein or axillary nerve, we have an idea that it's got to run through the armpit somewhere. The arm is brachial. So when we do muscles like the brachialis or biceps brachii, once you know brachial is arm, you have an idea as to where it is. The chest is called the thoracic region or thorax. That's the chest. The breast is called mammary. You know, women have mammary glands. So do men. Men also have mammary glands. But what happens is during sexual development, testosterone inactivates our mammary glands. It shuts them down. And estrogen activates the mammary glands in women. The stomach region is called the abdominal region, and the belly button is called the umbilical. When we combine the chest or the thoracic region and the mammary, the abdominal and the umbilical, we say it's the trunk, the entire trunk. So here, this is a drag and drop on one of the Connect quizzes. Pretty straightforward. So frontal bone, the eye we said was orbit, nose was nasal, chin was mental, ear is otic, the buccal is cheek, and now we're left with just these two, and we can figure it out by process of elimination. So right here, there's a little bit of a triangle, and then right here, there's a little bit of a triangle, and this muscle is called the SCM. The SCM stands for sternocleidomastoid muscle, and we have another one here. So these muscles are the lateral border of it, sternocleidomastoid. So the anterior cervical triangle, well, this is in front of the cervical spine, and then here's the lateral. Remember, lateral means away from midline. Here's midline. So if you move away from it, you're moving laterally. If you're moving towards it, you're moving medially. So here's the anterior cervical triangle, and then here's the lateral cervical triangle. Okay, let's move on. Let's look at some other parts that are significant. The wrist, we call it carpal. You've heard of someone having carpal tunnel syndrome. Well, in carpal tunnel syndrome, there's a nerve that goes to the first, second, third, and part of the fourth digit. It's called the median nerve. And here in the wrist, we have these 8 carpal bones, 4 in the proximal row. Then we have another 4 in the distal row. So now you're hearing 2 other words, proximal and distal. Proximal and distal. Distal means more distant, further away. Proximal is closer to the trunk. Distal is further away. So we have these 8 carpal bones. In the palm, we call it palmar. The thumb is called pollicis or pollux, and the digits are phalanges. Okay, now let's go to the foot. The ankle is called tarsals. Now remember, in the wrist, they're carpals. Just remember, you drive a car with your hand on the steering wheel, so car and carpals. And then tarsals, think of toes, T and T. So tarsals is involved with the ankle, carpals involved with the wrist. The toes, also their digits or phalanges, just like the phalanges in the hand. The great toe is called hallux, whereas the thumb was called pollux. Just remember hallux, the H, with heel. So the hallux, the great toe, is associated with the foot, which is where the heel is, so H and H. The foot is called the pedal foundation, just like you're pedaling a bike, pedal or pedal. The groin is inguinal. The pubic region, pubic. And the thigh, which is where we have the longest bone in the body, called the femur, it's called femoral. Okay. The leg is called crural, and the kneecap is called patella. Patella is the kneecap. Cephalic, again, on the back means head. Now look, we're looking at it from the posterior view. Posterior means back. Another word for back is dorsal. So dorsal and back are interchangeable. So is dorsal and posterior interchangeable. The neck is cervical. Here's the upper limb. The highest part of the shoulder is called the acromial process or acromial. And then the back of the elbow, if you're leaning on your elbow, like on a desk, it's called the olecranon process. So they call it the olecranal. Olecranal. That's the bony part of the ulna that you lean on when it's on a table. The lower back is lumbar. We have L1 through L5 vertebrae. There's 5 lumbar vertebrae. L is for lumbar, L1, 2, 3, 4, and 5. The rump area is called the gluteal region. So when we cover muscles and we do the gluteus medius, the gluteus maximus, the gluteus minimus, we know gluteal refers to the tush, okay? Behind the knee is the popliteal region. Remember, in the front of the knee was patella, but behind the knee, popliteal. That's this little depression back here and back here. The calf is called sural. The heel is called calcaneal. And the bottom of the foot is called plantar. Like the foot is planted on the ground, plantar surface. Okay, you're going to hear me talk about these terms, superior and inferior. They're opposite to one another. Anterior and posterior, they're opposites. And medial and lateral are opposites. I'm going to show you these on pictures where they're more meaningful. You heard me use the word proximal and distal before. They're opposites. Superficial and deep, they're opposites. And then contralateral and ipsilateral, they're opposites. So let's look at pictures to help us understand these a little bit. When we're referring to the human body as a whole, we can either move superiorly to the human body or inferiorly. Superior is moving up, inferior is moving down. That's when we're looking at the body as a whole. When we're talking about the limbs or the extremities, like the upper extremity or the lower extremity, we don't say superior and inferior, we use the word proximal and distal, whether we're talking about the arm or the thigh and leg. If we're at the beginning part, that's more proximal. If we're moving further away or distant to that, it's distal. So if we're up here, we're proximal. and now I'm moving distally to the patella. And now here's the patella, here's the leg. This is the proximal part of the leg. This is the distal part of the leg. Okay? If I'm up here, this is proximal for the humerus. Now I'm moving distally down the humerus. Now I'm at the proximal radius, and now I'm moving distally down the radius. Okay, so there's different ways of using the term. It's just that proximal and distal refer to the extremities. Okay, medial and lateral. If you're closer to midline, that's medial. And once you're moving away from it, it's lateral. So the medial finger, most medial, is the pinky, and the most lateral is the thumb. The nose is medial. If we move lateral to it, we get to the eyes. If we move more lateral and posterior, we get to the ears. Let's remember this is the right and this is the left because it's the individual's right shoulder or the individual's left. It's not our reading right and left, it's the patient's. Okay. Again, superior and inferior refers to the body as a whole. When we spoke about the extremities, we said proximal and distal. But when we talk about the trunk or the head, neck, and trunk, if we're moving to the head, we're moving cranially. And if we're moving to the tail, that's caudal. Caudal means tail. When you're moving to the front of the body, it's anterior. When you're moving to the back of the body, it's posterior. AKA for anterior, also known as ventral, and AKA, also known as posterior, is dorsal. Just like a shark has a dorsal fin, the fin on the back, a dorsal fin. Okay, let's go back here for a second. Let's erase this. The skin is superficial. If we dissect the skin and peel it away, we can get to the muscle that's deeper. So superficial is more to the surface, and deep is deeper. I hate using the word in the definition, but in that case, I have to. Patient came in with right shoulder pain and ipsilateral wrist pain. So right shoulder pain and ipsilateral wrist pain. Ipsilateral means same. If they had right shoulder pain but contralateral elbow pain, contralateral means opposite side. Okay. Good place to take a break.